Hello, I'm Dr. Ta from Siesta Village Dentistry, and today we are talking about TMJ disorder or TMD. TMJ stands for temporomandibular joint, and TMD stands for temporomandibular disorder or the disorders or the diseases of the TMJ. And that is the mixed factors, or there are many different causes for the TMJ disorders to occur. Some of those are you have pain when there are habits such as teeth clenching, nail biting, stress, painful conditions that occur along with the TMJ disorders such as fibromyalgia or osteoarthritis or the jaw injury. The habit of teeth clenching or grinding is also called bruxism. And most of the time, the pain and the discomfort related to the TMJ disorder lasts for only a limited time. There are some self-managed home care, physical therapy for the jaw, and the use of the mouth guard can also be effective in treating the TMJ symptom or the TMJ disorder. The surgery is always the last resort after conservative measures are taken. So some of the pains are as follow: pain or tenderness in the jaw, pain in one or bilaterally or both sides of the TMJ, the aching pain around your ear, the lock joint when you open your mouth and it just locked and you cannot open or you cannot close. You also get headaches in this area, okay, and you get pain right here, especially after you wake up in the morning, after you grinding your teeth at night. You also get some eye pain, some pressure, and there's some teeth pain along with the jaw tenderness due to grinding, bruxing at night. There will also be clicking and popping of your jaw joints. However, if you do not have pain from the clicking or the popping, there's no treatment is needed, but you should avoid to open your mouth really big or to bite into something that's hard or crunchy, and you want to avoid chewing gum in this instance, so then you don't aggravate the TMJ or the TMD. You do also need to seek treatment from your doctors when this occurs, when you have acute pain. As I've mentioned before, some of the causes, because it involves many factors in the TMD or the TMJ diseases. Some of them are the discs are eroded. So the discs are the cushion between your joint to your skull. And if that disc is eroded, then you would have bone to bone friction, and that would cause a lot of pain, that would cause inflammation. There's also ligaments, the soft tissues around the TMJ are sprained or strained, and that can cause also pain in this area, okay? Arthritis can damage the joint's cartilage and hence would cause the disease of the joint, and a blow or an impact to the joint can also cause inflammation and the TMD. Jaw muscles are associated also with the TMJ spasm. And many times the cause of TMJ disorder has variety of causes and it is hard to identify. So there's the list of things that we have to go through when we examine a patient with TMD. Next, I'm going to talk about the different diagnoses that doctors do in order for us to narrow down the ligaments or the joints or the causes that are more specific to an individual TMD. We do it by listening or feeling the jaw area. We touch inside, we palpate the muscles inside and outside. We press on the joint to find the focus point of pain and discomfort. Dental x-rays are used to check on your teeth and your jaw. We also use a CT scan to see the detailed images of the bone that's involved in these joints. The MRI will also show the issues of the joint disc, and it will show us more of the soft tissues and the ligaments that are associated with TMD. TMJ arthroscopy is sometimes also used to diagnose TMJ, and it involves a small thin tube that it's like a cannula that's inserted into the joint space to help with the diagnosis, and also to release the scar tissues and to remove the inflammatory tissues to improve the TMJ symptoms. So then that would free up the jaw to move freely. Some of the medications that are used in treating TMJ involve some painkillers, some just good old Tylenol, ibuprofen, or a combination of that, and also icing, ice packs, and warm compress. There's also a tricyclic antidepressant that can be used. It's used mostly for depression, but in low dosages, they use to ease the pain and to control bruxism and help with the sleeplessness caused by TMD. Muscle relaxants, these medicines are sometimes used for a few days or weeks to ease the pain caused by the TMJ disorders that the muscle spasms create. There are therapies that you can do, such as self-care to ease the symptoms. You can apply heat or ice depending on the type of the TMJ symptoms, such as avoid teeth clenching, avoid gum chewing and nail biting, good rest jaw posture, stretch your tongue out, put it on the palate. You want to stretch all these organs, all these muscles that can cause a spasm to the TMJ. There are also oral splints, such as a night guard to keep the teeth apart so you won't brux at night. There's also physical therapy, such as exercises to help stretch all the muscles from here, and your neck, and part behind your neck. That's just to ease with the muscle spasm that's associated with TMD. There's counseling also available to help, so then you can learn more about the factors and the behaviors that may worsen your pain, and also to alleviate some of that pain with some of the counselings that we have here, or any dentists or doctors that specialize in TMD treatments. But remember, clenching or grinding or leaning your chin or biting your fingernails will worsen the condition. We will have episodes weekly concerning TMD or TMJ disorders, and how to alleviate or help to ease the pain with different modalities. One of the things that are very important in correcting or to alleviate the pain completely from TMD, we need to look also at the occlusion and the bite. When they're missing teeth, when they're worn down teeth, that will cause your jaw to grind to accommodate the TMJ. And that will be in the next episode. Thank you for listening. I am Dr. Ta from Siesta Village Dentistry.